All right, we're very fortunate today to have Dr. Shannon Scott, who's a professor in the Faculty of Nursing at the University of Alberta, with us to talk about presenting research digitally. She is a Canada Research Chair for Knowledge Translation in Child Health and an Alberta Heritage Foundation for Medical Research Population Health Investigator as well. Her research program, if you're not familiar with it, you've probably seen many of the interesting graphics come out of it. It's called ECHO, or Evidence in Child Health, Translating Evidence in Child Health to Enhance Outcomes. Aims to improve the health outcomes of children in Alberta and Canada through the application of best practice evidence, as well as exploring factors that shape research implementation. So we're very happy to have her here today to talk about some of the tips and tools that she uses when looking to mobilize her research beyond the typical academic audience. So with that, I'll turn that over to you, Shannon.
Great. Thank you so much, Jared, for the opportunity to share with you a little bit about my experience in sharing research results. So as Jared mentioned, I think why he asked me to come to class is to talk about this because I'm a knowledge translation researcher. And that's when you see KT on my slides, that's what it stands for. And what that really is all about is decreasing the gap between what we know from research and what we actually do in our practice. And practice can mean different things to different people. It's about putting knowledge to action, so putting it to work in various ways. So I've been working in this field for the last 15 years, and I deliver a lot of different workshops to many different audiences on how to make research and knowledge be applied in different outcomes. And critical to that whole movement is presenting your research in ways so that it is understood and it engages people. So I'm going to share with you some examples about this. So just critical to this whole mandate is that I want you to all understand that knowledge translation isn't a simple or straightforward process, and it involves many different types of end users or users of our knowledge. And what's really critical to this whole movement is clear communication of research findings in ways that are appropriate to the end user. And I'm going to share with you some examples, and we can walk through this. So the messages you want to translate or transfer to your respective groups, they need to be in a way that is congruent or engaging for the end user. So you need to consider a couple of different things. So who are the end users of your research? And in many cases, it's multiple audiences. And in that case, and I deal with that all the time in my work, then we need to have different products or different ways of presenting our research to those respective audiences. And you also need to think about what your messages are. And in many cases, we can't present all of our messages in one particular product. We need to design them appropriately so they're not overwhelming. So some things to think about. Is it appropriate to think that the lay public would read complex academic publications? And up until quite recently, that was sort of the default, is that researchers would do their research and they'd publish their findings of their work, and they think, okay, wipe their hands clean, my job is done. And now we're starting to realize that yes, those publications are critically important, but we need to think of other ways to translate our work. On the other hand, let's consider, would researchers be satisfied with only a one-page summary and no description of the research methods? So again, it just highlights the importance of thinking about who are the end users and what are our messages. Now, some of the language that we use in the field talks about different types of knowledge translation, and what I'm really going to focus on here for the purposes of this hangout is more along the lines of the end of grant or end of project knowledge translation. So in other words, the end users are not involved throughout the research project, and that's a process that we typically would call integrated KT. And I'm not going to talk a lot about that form of knowledge translation. Just the end of grant or end of project KT. So you've done your project and now you want to think of interesting ways of presenting your results. So when we talk about that, there are many different ways that we can do that. It can be a diffusion approach, a dissemination approach, or an application approach. And as you can see, when you go from diffusion to application, there's more of a sense of a tailoring to the respective audience. So typically what people think of is like what I mentioned. In the past, we do our project, we publish our findings. Now I know Jared's really pushing you in your assignments for this respective class to present your results in different digital formats, and I'm going to share with you some examples of this. So for non-academic modes of communication, typical end products are things such as lay summaries of the project. In this case, we tend to want to aim for a grade 8 reading level or less and one-page summaries. We're also using YouTube very frequently as a way to engage with people as well. These are the factors that you should be considering in terms of presenting your results. What is the goal of your respective product? Is it to raise awareness or share the findings of your work, or is it to promote action or behavior change? Who are your audiences? How do you want to reach them? What expertise do you need in order to reach them? And there's some more sophisticated approaches to translate knowledge that I really won't get into, but it is something, it's a point to consider. And what resources do you need? So different approaches we've used to share data digitally are your basic conventional PowerPoint presentations like we're having here, Prezis that we do use. So that's where elements of the presentation, you can zoom in and out of them. And it's a little bit more engaging and easier to keep people interested in the content. YouTube videos and whiteboards, and I'll be showing you some examples and giving you some websites to check out where we are doing some whiteboards. Infographics and stories. So a very interesting initiative we're doing right now is we're looking at the use of whiteboards, and they're called RSA whiteboards. And I'm not going to show this to you in real time. I was a little bit worried about this respective technology working in this interface, but the website is available below. This is a 3-minute video where we are getting our main points across through the use of a narrative. So we have a voice occurring at the same time as we have art being drawn. Now this is just a static picture. And then at the end of the 3 minutes, we zoom out and we've got a picture that shows sort of the whole image of what we're trying, the main message we want to get across. So this respective whiteboard with the YouTube video at the bottom is an example of a large research program that I'm involved in where we're trying to improve children's emergency care throughout the country. I do have a large national research grant right now where we are developing whiteboards for parents with ill children and testing this out in terms of a novel way to translate our research findings to them to help make them more informed decision makers. So whiteboards are a novel approach that we're starting to use. Now, don't think that you always need to hire somebody to do this work. There are many programs available online that allow you to do this service for free. So innovative, and also try doing a Google search of Dr. Mike Evans, who also has used this approach. Another approach we're really using a lot in my program to present and share data are infographics. And so what you can see on this slide is that I am sharing the same results, but putting them in a different format. Now, traditionally on the left, this is the way that we would share the results of our research. So bar charts are very, very common. And we wanted to have a way that we could share knowledge in a way that would provide engagement, it would be interesting, and sustain people's interests. What we're actually also doing with these infographics is we're using them on my embedded social media platform. So not only do we use this as a way to visualize our findings, we are using them as a way to engage and create communication. So we put an infographic on my web page and on my Facebook, and then we send a tweet out about it, and then it causes discussion. So I put them side by side because this is actually the same information being presented different ways. Here's another example just to show you what's possible with the infographics, but also I think it promotes further engagement, and it also allows us to engage with different audiences. Now, not only did we just try these different examples, we've also been evaluating different end users' responses to these approaches. So I certainly don't work independently. I have a large group of very talented trainees working with me and staff. And this past summer, I had the pleasure of having an undergraduate research trainee in my lab, Miss Amy Gonzalez de Hermes, who worked with me in one of my large research projects to test different approaches of conveying research findings to parents with ill children. And what she did, you could see in the second column in terms of the methods. She presented the results in terms of basic graphs. She also presented them in terms of infographics and videos. And then we developed a survey and asked parents what they wanted or what they preferred. And in terms of that, the preferred approach by the majority of the respondents was the infographics. In fact, the graphs, the traditional academic graphs, were more preferred over the videos in this respective sample. So that just gives you an idea. So not only are we trying these approaches, we're also evaluating them and getting information and feedback from our end user and then modifying our approaches. So not only did we ask about preference, we also asked about clarity of the different approaches, how easy it was to understand the results, also in terms of we evaluated aesthetic appeal. So not only have we evaluated infographics and videos in terms of healthcare consumers' response, so quite a lay audience approach. The previous summer, I had another undergraduate student, Annie Pentney, who is now a registered nurse. She worked in my lab, and we looked at different ways of presenting results to a health prioritization committee who was trying to determine priorities for a large national health research group. And we just compared two different approaches there in terms of presenting research data in terms of infographics versus traditional. Also assessed similar components in terms of clarity, how easy it was to understand, and the aesthetic appeal. And with this more specialized audience, there was again a preference for the infographic approach over the traditional academic approach of sharing and displaying data. So something to keep in mind as you move forward with your own projects. There's many different free software programs available on the web to present data using infographics compared to traditional pie charts, bar charts, etc. And it's a way that you can engage and create conversations. So like I mentioned, we are embedding this in our social media platforming and using it as a way to further create engagement, so it's not as static. Other ways we're presenting and sharing our data is through the use of stories. So this is with quite a lay audience again. We wanted to transfer the results of systematic reviews, so which is a scientific process of synthesizing results from many different primary studies to get sort of a lay of the land or state of the art on a particular topic. And croup is a very common viral illness that young children get. But there is some inconsistency in the literature in terms of treatment. So we wanted to develop a new way of transferring this information to parents. So collectively, Dr. Terry Clausen and Dr. Lisa Hartling and myself worked with graphic designers and writers to develop narrative stories. So we also worked with parents to understand what it was like to have a child with croup, to create stories, composite narratives, where we embedded the best available research evidence within the story. So this just gives you a look at sort of the front page of the book. And we also synthesize the main points at the end. We're now taking, we developed 3 books. They were hardcover books in paper form. We're now taking these books and putting them in a digitized format for parents and offering them on the web. So right now we're currently in a usability testing format. But just again, to give you another example of using different ways to transfer research results to different audiences. So this just gives you an idea. These are just some of the screenshots from it. We've also embedded audio within this different approach of sharing research results. So would this approach work for healthcare professionals? Certainly it wouldn't be enough on its own, but very positive response from healthcare consumers when we've used this approach. In our team, we've done randomized control trials testing the effectiveness of this approach, as well as qualitative studies looking at how parents use these devices. This is just a screenshot from one of my current doctoral candidates' ebooks where she's developing, so again, merging the power of art and narrative to transfer complex information for parents with a child with asthma. So to give you a sense of, again, another approach, and this just demonstrates, in this case, we used a different writing style and different graphics. And I just wanted to follow up a little bit more with this whole notion and idea of using infographics. So not only can they be used to share the results back with respective audiences, as well as being used on a social media platform, we're also now integrating them into research posters. So this is just an example of a research poster we developed last fall, presenting the results of a large pan-Canadian study. We then used these different approaches, the infographics, on our research poster. And what we've learned from this approach is that it's also very useful to transfer a large amount of information in a quick period of time to researchers and other healthcare professionals. So great response through displaying our data in this format. In terms of other ways to present research, I encourage you to check out my webpage, which is www.echo.ualberta.ca. We've got all our respective research projects listed, and in there you can find different ways of presenting and sharing research results that may be useful. I would encourage you to check out the research poster gallery because we share examples of recent posters in there. So that's all for the formal presentation. I'm really hoping that people have questions and we can engage in a dialogue.
Great, thanks, Shannon. Very helpful. And I know knowledge translation seems to be the lingo that's used in the STEM field. Knowledge mobilization is the term that we find being thrown around quite a bit in the social sciences and humanities. But I think we're getting at some of the same core points. Does that resonate with you?
Absolutely. It's interesting you bring that up, because just last week I was in Ottawa at a terminology meeting for the knowledge translation field, because as a knowledge translation researcher, we use different language depending on where we are in the world and which groups we're working with. So for instance, if I'm over in Europe, I'm not talking about knowledge translation. I'm talking about implementation research. Same thing, different words, and it's largely based upon geography as well as the discipline we're working within. So knowledge translation is the preferred term in health in Canada, largely because of our national funding agency, CIHR, that adopted that term back in 2001, and we've all sort of come on board and started to use the term because that's our primary funder.
And it's the same thing over in the social sciences and humanities, right? With SHRC using the term knowledge mobilization. I think that's where that comes from. But I did find it interesting that in one of your opening slides you said knowledge translation also includes things like dissemination and application. I think too often in the social sciences we jump straight to mobilization without thinking first, how am I going to translate this research that I've done into a way that's more easily accessible to my audience? And I think that you raised some good tips for folks that are thinking about that.
Yes, absolutely. And there's another common slide that I often use for a presentation like this, because for many years I remember being a doctoral student sort of floundering around in the area, because I would go to so many different conferences, and when you're a doctoral student you want to become expert in your respective field, and I would be at conferences and thinking I was very well read in the area, and somebody would come up to me and they would say, "Oh yes, I'm in the knowledge translation field," and I thought to myself, I haven't read any of their work. What's going on? What have I missed? And it's largely of a problem of semantics. So, all of us that are creating knowledge have a responsibility to do some form of knowledge translation, whether that be writing a report at the end of a course that talks about the results of our research, or whether that be going to a conference and presenting it, or synthesizing research and then creating a clinical practice guideline or a policy recommendation, so it's based upon the state of the science in that respective area. But we all have a responsibility to do some form of that if we're doing research. But then there's a smaller group of us that also study knowledge translation and trying to find out the best, the most effective ways to put research into practice, and comparing and contrasting different approaches and finding out which approaches are more effective for respective audiences in particular situations. So, that nuance is very important.
Great. Well, I'll turn it over to our students if any of them have questions.
I have a question.
Yes, Brent?
Yeah, so first of all, thanks very much for your presentation. Really interesting. I didn't realize how big of a field and how big of a subject it is. I didn't realize how much it really opened my mind in that regard. I was just wondering, do you have a list or sort of a order of favorites of tools that you use to create infographics? I know you had mentioned this, and I looked at the website, that Echo page, but I can't seem to find like a list or some sort of like order of favorites of free software infographics. So do you have that prepared, or do you want to sort of find it on that website somewhere?
Sorry, Shannon, I'm not sure if Brent's question was clear on your end. It wasn't quite clear on mine.
Yeah, it wasn't clear on mine either. I was just going to thank Brent for his comments and just let you know, I think what you were asking me was for a publication on how to create infographics. Is that correct?
Well, I guess what I'm looking for is like a list of free software tools that you can use to create infographics.
Yeah, so what I could do, Brent, is I could get my undergrads that worked on this particular project, because they created that list, to send it to Jarrett. How would that be?
That would be extraordinarily helpful.
Okay.
Sounds good.
Is that okay with you, Jarrett?
That sounds great. Well, and I'll pass it along to students, and I'll even, if it's all right with you, we can even post it on YouTube too.
Perfect.
Perfect. All right, any other questions from the class? You've given us a lot to chew on today, Shannon. I've got one question for you.
Sure.
A lot of the infographics that we see that are out there, and yours included, tend to feature a lot of quantitative information. And one of the challenges that we find for those of us that work in more qualitative styles of research is trying to convey our findings in a concise manner. And you've suggested using stories and narratives, and that's one that I hadn't considered, but it's definitely one that I will consider in my future knowledge mobilization pieces. Any other tips for folks that deal with more qualitative research? How do they bring it all together in a more manageable, accessible format?
Great question. So generally speaking, I am more of a qualitative researcher myself. So I struggle with this all the time. And that is part of the reason why we actually got into the whole realm of using narrative, because qualitative research, in my opinion, lends itself so nicely to the use of stories. And when I send you the list of different free infographic software, I can also share with you we've got 3 really comprehensive publications that talk about our experience using stories and the power of stories as a way to transfer more qualitative work. That might be helpful for you. So with the infographics piece, absolutely. I agree with you 150% in terms of the challenges with qualitative work. The infographics I shared with you was a very large quantitative survey. It was a pan-Canadian study that I did looking at healthcare professional and healthcare consumer information needs on taking a child to a general emergency room department rather than a pediatric emergency room department. So I think that speaks to what I brought up earlier about the congruence between the type of data that you are trying to transfer or make available and the mode. So, you know, that piece is critically important. Because, for instance, if you were to take the themes from a qualitative research project and distill them down to infographics, I think that you would lose so much of the richness of the qualitative data that we always find so useful. So that point's really important. It's a great point.
Yeah, I've seen some infographics that deal with things like processes and timelines. You know, flowcharts and timelines can be quite effective using an infographic, but I find a lot of the qualitative stuff, as you said, is featured either in stories or videos sometimes, or even one-page synopses that are more, you know, a bit condensed, but at the same time maintain some of that richness.
Exactly, yeah.
That's one of the challenges that we run into when doing qualitative research, of course, is because in political science especially, a lot of our journals are heavily quantitative, and we're kind of caught between a rock and a hard place, because on one hand, the folks that want to access our qualitative research keep demanding that we have as much evidence as possible. But the space constraints within a journal are such that you can't really include everything from all of your respondents in an interview survey, or from all of your texts if you're doing a qualitative textual analysis. So I think this is the new frontier for folks, especially in the social sciences and humanities. How do we boil down what we have in our qualitative research without losing the flavor? And I'm using that metaphor deliberately.
Yeah, absolutely. I struggle with that too, and you know, sometimes with these more open access journals, what I've learned is that I can sometimes upload more additional files, which is useful with qualitative research projects, because many times the page restraints, the page limits in respective journals are really quite limiting.
All right. Well, that's it was maybe more of a soapbox on my end. So I appreciate that the challenge exists across the disciplines. At least maybe we can all get together and try to solve it together. Any last questions from students in the class? Seeing none, I anticipate there'll be a lot more when folks tune in online afterwards, Shannon. So I hope you're okay if they address you through your contact information online.
That's perfect. Absolutely.
Perfect. Or they can go through me, and I'm happy to pass along that information. Thanks again for joining us today, Shannon. I really appreciate it, and I hope that this is the first of many conversations that we have across the disciplines about the importance of knowledge translation. So thank you very much.
You're very welcome. Thank you, everybody. Have a good Monday.
You too. Bye-bye.
Bye-bye.